On this edition of the Best Docs Network featuring Forest Park Medical Center, ENT Robert Wyatt, OBGyn Nicholas Lux, General Surgeon Charlotte Hodges, Bariatric Surgeon Daryl Stewart. Hi again, everyone. I'm Candace Kruger along with Jim Knox, and we're back again with another edition of the Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, of course, is one of the premier medical centers in all of the Dallas-Fort Worth area.
And of course, a number of outstanding doctors operate right here out of Forest Park Medical Center, like our first doctor, Dr. Robert Wyatt, who helped one lady breathe easier again.
Prior to coming to see Dr. Wyatt, I was constantly clogged my nose, constantly having to blow my nose. I was carrying toilet paper around with me constantly and was just miserable. I couldn't smell at all, had a hard time tasting, and it really affected my lifestyle. Jenna
has been a patient of mine for a long time now, and she has very serious problems with sinus infections, sinus polyps, allergies, and associated problems with asthma.
I wanted to find out what was going on so I could breathe better and be functional.
She has a lot of problems with chronic sinusitis with the formation of a lot of polyps. It's driven by her allergic disease and underlying inflammation that she has all the time. One of the big problems she has is something I see very commonly where sinus problems are making asthma worse.
He explained to me that I had a lot of polyp development in my nose and that he needed to remove them so that way I could breathe better and that way everything would flow more clearly and I would be able to smell as well.
So one of the things that happens to her when her sinuses start causing trouble is her asthma gets a lot worse. I would never be able to cure her, but I would be able to dramatically improve her quality of life by cutting down on the medicine she had to take all the time, improving her breathing through her nose, her sense of smell.
Dr. Wyatt has changed my life in many ways. First of all, being able to smell my own perfume. Yeah, he's definitely changed my life. I can taste food again, I can make trips with my husband, and I can have a normal life. I love being able to smell flowers.
And she's one of those people, unfortunately, that I have not been able to go in and cure with a single surgery, but because of the minimally invasive techniques that I'm able to employ now, even though she requires surgery to clear out polyps every 18 months to 2 years or so, she's able to get that done and tolerate that with very little downtime.
He is a great doctor. I love that he explains things to me well. He shows me things. He helps me out with new medications if I'm on them. He coordinates really well with other doctors. I just love Dr. Wyatt and his team. I would definitely recommend Dr. Wyatt.
I went bowling as a team building thing for my school, and I picked up too heavy a bowling ball, and then it aggravated my elbow. After a few weeks, I decided I better come because it wasn't getting any better, so I better come see Dr. Michelsen, the fourth member of my family to come be a patient of Dr. Michelsen.
When patients come into the office, they want to be heard. And I think it's really important to sit down and spend the first 5–10 minutes with the patient, letting them explain to me what's hurting them, what is the history of their injury, and let them express why it is affecting their life.
Dr. Michelsen has performed 2 surgeries on me, and anything going forward will be by Dr. Michelsen as long as he's in this area. When I sit down and talk to him, it's like talking to one of your best friends. He treats you like he's not in a hurry. It's like you're the only patient in the world that walks into his office that day.
We have our own physical therapy unit, staffed by therapists who have their doctorate's degree, and physical therapy. We stress hands-on. We really want our therapists to get their hands on the patients, work with them. It's important that they spend time with the patients just like I do in the office.
Physical therapy is right upstairs from the office, and we live 5–10 minutes away, so it's very, very convenient. I was at physical therapy 2 times, I think, and the therapist already knew me and knew exactly what part of my elbow was hurting.
A fulfilling thing to me is when we finish treating them, whether it be a child, whether it be a rotator cuff repair, whether it be a tibia fracture that occurred during a soccer game, is to have that patient come back in, now with a smile on their face, and walking out the door and participating in the sport or the activity that they used to participate in.
You wouldn't believe how many times people say, hey, can you send me Dr. Michelsen's information? When people ask who my primary care physician is, I always say Dr. Michelsen.
It is very reassuring, especially with 2 very active boys, to know that there are doctors like Dr. Michelsen and his staff.
Time to get in the holiday spirit. This is Forest Park's 4th year donating for Toys for Tots. Collection boxes are located in the lobby of all 3 buildings on Dallas campus. In Frisco, the collection box is in the main lobby. New and unwrapped toys for all ages are needed and appreciated. Toys can be donated through Monday, December 17th. Best Docs Network featuring Forest Park Medical Center. Forest Park Medical Center, extraordinary in every way.
Forest Park Medical Center is one of the premier medical centers in all of Dallas-Fort Worth area, and of course they have some of the most amazing physicians that operate there. Like our next doctor, it's gynecologist Dr. Nicholas Lux.
One of the most common problems that a lot of women do not know much about, or a lot of women haven't even heard of it, is a condition called polycystic ovary syndrome. Women who have irregular cycles, or they have a history of missing a lot of cycles, or they have overt pelvic pain, are often found to have this condition.
Before I came to Dr. Lux, I was having a lot of irregular periods, and I couldn't even walk sometimes because my pains were just really, really bad. They were sharp, and just getting around, it was just really hard for me.
Now in Marley's case, she came in about a year ago with symptoms that are very typical of PCO, and that consisted of irregular cycles and pelvic pain. We did an exam, pelvic sonogram. Turned out that she has polycystic ovaries, and she also had some findings I thought might be typical of some other conditions that can cause pelvic pain, such as endometriosis.
So Dr. Lux sent me here and had the sonograms. And then after I had the sonos, and it showed that I did have the polycystic ovaries, which was cysts around my ovaries. I had one big cyst, but then I also had several different little ones too.
Treatment of PCO and pelvic pain consists of a surgical option versus a conservative option. It depends on what your goals are, it depends on the severity of the symptoms. In her case, she was in pain and she wanted to do something about that.
I went in the Thursday before and had the pre-op, and then after I had the pre-op done, they kind of told me, you know, how long I was going to be out of work, and I was only out of work a week. I was there like probably an hour after the surgery in recovery, and then I was able to go home that same day. If any woman is having pelvic pains, I highly recommend seeing Dr. Lux.
Did you know Forest Park Medical Centers utilize a paging system similar to those found in many restaurants today? The paging system notifies patients' family members as to their location and status while undergoing surgery at Forest Park. The system also allows the surgeon to contact the family members to update them on their loved one's surgery.
I weighed 485 pounds. I've lost a little over 300 pounds in a period of a little over 4 years. I did it without surgery. I just woke up one morning and decided I was tired of being the fat guy, and decided I needed to make a change, and from that moment on, I changed it.
When we talk about massive weight loss, this is different than somebody who is on a post-pregnancy diet or lose some of that college weight. That's not the patient population I'm talking about. I'm talking about patients who have had massive weight loss. And these patients tend to do this in a very rapid way. This can be as a result of surgery. Likewise, some patients, some people can do that without needing surgery. The result on their skin and their body shape is oftentimes very similar. What happens is your body's metabolism and physiology is different. It changes. You have a deflationary effect. So whatever skin that you used to have in fat, just imagine the fat going away and the skin being left behind.
Dr. Hodges is actually an acquaintance. His wife kind of grew up with my wife, and I had, as I was losing weight, had planned when I got to my goal that eventually I would meet up with him and get him to do the plastic surgery to take care of the extra skin from the weight loss.
With Mr. Winters, I was able to sit down with him and we came up with a very tailored, specific plan for him. His primary concern was around his trunk, his arms, and his breast. But we addressed all those areas through a comprehensive body lift, and his results are outstanding. One
of my favorite things to do is I road bike, and as I would bend over, you'd feel, especially in the abdominal area, you'd feel that skin as I was bent over biking. Now it's just a natural curve and feels normal. Dr. Hodges is professional from the get-go. He's going to let you know what you're up against, how it's going to work, and the way it's going to all pan out. Everything that he told me in the very beginning is exactly how it went.
One of the main reasons why I came to see Dr. Angobaldo was because I was not happy with the symmetry of my breast. I do body figure competitions, and when I lean out, you could really see the symmetry of my breast, where my left one was a lot lower than my right one. The implant was very noticeable, and also wearing a bikini top, you can see that the left breast was a lot lower than the right one. And so I always either had to pad it or tape it or do something so that it wouldn't be as noticeable. And it was just very bothersome.
So the initial consultation with Claudette, she was unhappy with the asymmetry of her breast. She had previous breast implant surgery by a different surgeon several years ago, and she thought that one implant was lower than the other, which caused less fullness in one breast than the other. She was very self-conscious of that. She competes in fitness competitions, and she wanted also to switch out from a saline to a silicone implant.
As far as the procedure, pre and post, the pre was very comforting. The staff was wonderful. I never felt nervous. Everything from Dr. A to the nurses and anesthesia was great. Post-surgical, probably 2 to 3 days is what I took, and then I was able to get back into my everyday life routine.
Claudette is doing fantastic. She is 5 weeks off from surgery. She's had no complications. She's perfectly symmetrical. She looks fantastic, and I'm gonna free her up to start competing again and working out within the next week or so.
Now that I've had the surgery and I'm symmetrical, it's definitely a boost of confidence. I don't feel like, I'm being watched or I'm lopsided, so I can't wait for my next competition. Dr. Angobaldo's bedside manners, for me in my experience, were wonderful. He was very positive throughout the entire process, starting from the consultation to the pre-surgical and post-surgical.
For more information on Forest Park Medical Center and their outstanding doctors, please head to the website bestdocsnetwork.com and click on Forest Park.
And now we're going to meet our next outstanding Forest Park physician. It's General Surgeon Dr. Charlotte Hodges, who helps one patient lose a lot of weight.
I saw Jamie in our office as a typical bariatric patient. She had a BMI of 42, really no other health problems besides her obesity. She'd never had surgery before, and she had no significant past medical history for abdominal pain or really any significant family medical history.
Before the surgery, I just wasn't feeling very good about myself. I didn't really want to go to the gym. I kind of just wanted to hang out at home and be miserable.
The first portion of the surgery that we do is we make our small bowel anastomosis. That's where we hook the small bowel up together. As I began to initially run her small bowel, the patient was found to have a really large mass at the base of her mesentery.
So when I was under for the gastric bypass, they were doing the surgery at the same time that they found the tumor in the small intestine. So they went ahead and continued with the surgery on the gastric bypass because the pathologist thought that it would be okay.
It really concerned me because when you have a mass like that, it could be a benign lymph node, but it could also be something more malignant. It could have been a lymphoma. I did discuss with the surgical oncologist at that time, should we move forward with her bariatric procedure in the event that it was lymphoma, and he reassured me it would actually be very fine, even if it came back, worst case scenario, came back a lymphoma. So we went ahead and we moved forward with the bypass.
So since surgery, I've been working out more. They do suggest 30 minutes a day to start out with. And now I love to go to classes. I've been doing Zumba lately. So that's been a lot of fun, and I don't think I would have done that before the surgery. My confidence is definitely up. I love hanging out with my friends, and I just feel better about myself.
Jamie's actually been doing very well since having her surgery. Her pain is very well controlled. She's been able to go back to work. She's tolerating her diet. As far as the mass, she's really had no other residual problems since removal of the mass. I don't anticipate her having any problems in the future either.
My friends and family have noticed a great energy change in me. I'll dance around the kitchen, and I'm always ready to go. Whatever they want to do, I'm ready to do it. And they call me a skinny mini now, so it feels good.
Raymond, a loving father of 3, had sleep apnea. At times, he stopped breathing at night until he met Dr. Trone. To find out more about Raymond's story and other life-changing stories, log on to bestdocsnetwork.com.
Stephanie has a question for Dr. Pero. She'd like to know, can someone with severe allergies be helped with surgery?
A lot of patients have severe allergy problems, and many of them also have chronic sinus infection problems and or nasal obstruction. Sometimes those patients can be helped with surgery, and typically like to make sure that we have their allergies under as good a control as possible before deciding to proceed with surgery. In other words, the allergies themselves might be contributing to swelling in the nose, which could be contributing to blockage of their breathing, could be blocking the openings of the sinuses that lead to sinus infections. Our hope would be that we could treat the allergies by themselves, which would decrease the swelling enough to improve their airway and decrease the severity and frequency of the infections. In some patients, based on their anatomy, that's not possible, and those patients are ones that would benefit from surgical intervention.
For more information on Forest Park Medical Center and their outstanding doctors that, of course, operate out of Forest Park Medical Center, head to the website bestdocsnetwork.com and click on Forest Park. Right now, it is time to head to our next doctor who operates right here out of Forest Park Medical Center. It's Dr. Daryl Stewart.
I had a lap band performed by another physician, and then in 2010, Dr. Stewart did a revision to the duodenal switch because I was having so many complications from the lap band. Specifically with my esophagus, I was having trouble keeping down liquids, and just eating was a problem for me. So it was really taking its toll physiologically. Revisional bariatric surgery, what is it? It actually is somewhat of a vague term. It could mean anything from trying to fix a problem. You know, someone has a surgery and they have a problem with it. They need a little help to get over that, whatever a side effect or complication or just symptom is. But it could also mean
if the patient is unhappy with the results.
I did significant research and found Dr. Stewart online, and I liked the fact that he offered several different weight loss surgeries, which was key for me to have a choice as a patient. I used his website to research the specific surgeries, and I felt like duodenal switch was the right surgery for me. It offered a chance for me to maintain a normal weight and also lessen the chance of regain later on down the road.
When we have patients that come to see us who've had another procedure and they just haven't had good results, or maybe they had good results initially and then they've regained their weight. Our approach is going to be not to blame the patient, but to look at did the patient have the right procedure to begin with. I'm more going to counsel them about, well, maybe we need to take a different approach, and maybe that approach needs to be tailored after your particular situation.
Dr. Stewart as a person is just wonderful. He's very precise, and you can tell he's a very skilled surgeon. He explains things in detail. He makes it to where you're ready to take that next step. And his whole entire office staff walks you through the process step by step, so you don't feel afraid. You feel like you can confidently go forward.
This is what's called the Medtronic O-arm. It's a combination of traditional fluoroscopy with also a three-dimensional imaging component. Within 26 seconds, it will take 755 high-definition images. With the O-arm, we can actually take shots of the spine in a three-dimensional nature because the spine is a three-dimensional structure. And the value of that to a surgeon is that they can now see the spine in 3 dimensions and truly be able to determine with precise accuracy their placement of the hardware. The device also enables minimally invasive surgery. By more precisely placing the screws, he's going to be able to allow the patient to have a quicker recovery time and hopefully have a better quality of life post-surgery due to the more accurate placement of the hardware which the O-arm enables. We have the O-arm itself, which collects the images. We have the viewing cart, which the images are reconstructed on. And then we also have the stealth navigation image-guided surgery unit. After the images are recreated on the spinal navigation unit, the surgeon is able to bring different surgical instruments into the field that will help him more effectively place the instrumentation into the patient's back in a three-dimensional nature. Because this device is used intraoperatively, the surgeon can use the image-guided surgery unit to do the remainder of the case without additional radiation being delivered to the patient. The benefit of that is to the patient that they will potentially not need to be sent for a post-operative CT to check the final placement of their hardware, since they're able to do that real time in the operating room.
Time to get in the holiday spirit. This is Forest Park's 4th year donating for Toys for Tots. Collection boxes are located in the lobby of all 3 buildings on Dallas campus. In Frisco, the collection box is in the main lobby. New and unwrapped toys for all ages are needed and appreciated. Toys can be donated through Monday, December 17th. Best Docs Network featuring Forest Park Medical Center. Welcome to the 21st century of cutting-edge medicine. Forest Park Medical Center.
My reflux was getting progressively worse to the point to where I was getting reflux from drinking a glass of water. And I'd gone to a gastro guy before, and he had told me, oh no, that's at least 5 to 10 years down the road. And then the next week I saw Dr. Ihde's piece on the news, and I gave him a call and said, hey, let's do something about this.
When patients come in and they have a variety of symptoms, some of which may be reflux and some of which may be other disorders, there are a lot of different tests that we can do. Upper endoscopy, pH study, manometry, a new study called impedance, upper GI study, which is an X-ray study, and also even looking at the gallbladder to see whether that's working. We have all those different tools to help us tell, is this reflux, is it something else, or are there two things going on? And to be able to get the right evaluation is very important, because if you don't have the right diagnosis, obviously the treatment's not going to work.
We did the endoscopy and took a look, and he said, yeah, you're a candidate for it. He explained to me that I had GERD, which is Gastric Esophageal Reflux Disease. And the procedure would be called a TIF procedure, transoral incisionless fundoplication.
When patients come into the office, we will sit down and discuss their symptoms. And we'll evaluate both their symptoms, we'll suggest a workup, then we'll decide whether they're a candidate for the surgery or whether they should have further evaluations to rule out some of the other conditions that can contribute to reflux.
I remember the first appointment prior to having the procedure, he had a dry board, and he drew his drawings and explained what was going to happen during the procedure, what was going on in my body. Dr. Ihde explains everything. A, B, C, all the way down to the Z. He explains it all, and he's very methodic, and he's open to any questions you want. He gets the job done. He's great, got a great bedside manner. I was able to enjoy life again.
The main part that prompted me to call Dr. Nicholson to have the surgery is I was at a pool with my youngest daughter, and she wanted to go down the water slide. Just the fear of taking off my towel, going swimming with my kids was a big downfall with my weight. So I finally decided that the only way that I was going to make myself feel better physically and mentally was to look into having the surgery.
Traci just got to the point where she's basically a very happy, fun-loving person that was just always very carefree, and her weight got to the point where she was no longer happy.
I think one of the best parts about Dr. Nicholson's clinic is that when I first thought about doing the surgery, I didn't know what to do. I have insurance, but I don't know what my insurance covers. So when I called their office, I told them, gave my insurance information, and they took care of all of that. They called the insurance, they told me what they covered, they told me what my copay was. I didn't have to do anything.
Traci ultimately decided on a gastric bypass, and she's worked very closely with us for a long time before deciding on that. So I think she made a very well-educated choice for her unique situation. The surgery was the easy part. I mean, I really think that is the minimal amount that needs to be done. That's the 10%. The art, if you will, in the practice of this medicine is the other 90%, and that's treating the issues for why people are overweight. Let's face it, the reason people are overweight is going to remain after they have surgery.
The surgery is only a certain part of the whole actual act of having weight loss, and then afterwards you have to worry about what you're going to eat. The dietitian you go to, they go through what you can have, what you can't have, teach you how to go through the labels, and it seems very daunting at first, but once you really get into it, it's very easy.
So many people come in thinking, well, I'm going to have surgery on Monday and I'm going to lose weight on Tuesday, and the reality is it doesn't work that way.
If I could just take Dr. Nicholson's group and just put them in a little package with a little bow, I would say, this is what you need to do, because it's everything. It's the whole package deal, and that's what I loved about his office.
Well, thanks for tuning in, everyone. That'll wrap up another edition of the Best Docs Network, featuring Forest Park Medical Center, one of the premier medical centers in all of Dallas-Fort Worth.
That's right. If you want more information on the Forest Park Medical Center, as well as the outstanding doctors that operate out of Forest Park Medical Center, you can find out all the information. Head to the website, bestdocsnetwork.com, and click on Forest Park.
And as always, if you have a question or comment, we would love to hear from you. Send us an email at info@bestdocsnetwork.com.
So long, everyone. We will see you next week.